Welcome to Bootleg Nursing. Today I'll be demonstrating an AccuCheck and mixing insulin. Hi, can I get a name and date of birth?
Gloria Matthews, September 2nd, 1945.
Wonderful. I'll be doing your insulin today. And before I go get it prepared, I want to give you a quick overview over the insulin that you'll be having today. You'll be getting regular and NPH. NPH just lasts longer than regular insulin. And to go into more detail about that, regular insulin has an onset of 30 to 60 minutes, and it works best around 2 to 4 hours. It lasts about 5 to 8 hours and should be taken 30 to 60 minutes before each meal. But we are going to be mixing your regular with NPH. So you're going to have two types of effects happening. NPH insulin has an onset of 1 to 2 hours. It begins to work best at 4 to 12 hours and lasts about 18 to 24 hours. This one should be taken 30 minutes before your first meal of the day, which is why I'm here to give it to you before breakfast. Since you are diabetic, what are some things you feel when your blood sugar is low?
Usually, my heart beats quickly, and I begin sweating and getting clammy. I feel confused, dizzy, hungry, shaky, and I get irritated easily. If it goes on too long, I get nervous and full of anxiety.
Okay, that's normal. Do you know where you store your insulin at?
I couldn't remember where the doctor said to put it, so I just put it in the medicine cabinet.
Okay, I'll help you with that. Where you should usually store it is in the refrigerator because it's convenient and there's no point in buying your own device for it. The reason why you want to put it in the fridge is because it needs to stay between 36 to 46 degrees Fahrenheit. So do you know how to administer your insulin?
Not really, my daughter does it for me.
Okay, would you like to learn how to do it yourself?
That would be nice.
Wonderful. So what we're going to do is I'm going to show you where you can administer it first. So you can go anywhere on the abdomen, the lower abdomen, at least 2 inches from your belly button. And the best way to remember how to do this is you can have 4 quarters of your belly, and then you can divide those 4 quarters into a further 4 quarters. So you can really start moving where you inject it, if you're a very visual person. If you're not, you can kind of just work your way around the abdomen every time you need to give yourself a shot. So you should be using a 50 to 100 unit syringe, and it's a standard syringe for insulin. You can't use just any syringe. And it usually has a fixed 1/2 inch needle to it. I'll go ahead and show you the syringe I'll be giving to you. This is called the plunger right here, and you don't want to touch it with your finger because that's considered sterile, meaning it's like super clean and you don't want to contaminate it. And then you want to push up here to administer it. And then you want to just keep holding it at the syringe. You want to hold the syringe, not the plunger. And then when you go to give it, you're going to use the syringe's lips here to brace it. You, of course, want to pinch your skin and put the needle in at 90 degrees and slowly push it and let go. Well, of course, take the needle out, then let go. After that, you'll put it in a dedicated sharps container at your home. Did you get that, or would you like me to explain it again?
I think I got it. Thank you.
Okay, cool. I have a demonstration vial here for you, and I'm just going to show you what you have to do when you're trying to draw up insulin and administering it to yourself, so that way you know what you do at home. Of course, you can always get a more straightforward option that they'll already be pre-packed for you, and you don't have to go through this step, which I highly recommend. And I can help you figure out what kind would be best for you. So you have your vial, and what you want to do is regular insulin, you don't need to do anything with. You're just going to wipe down the top with an alcohol pad for 15 seconds. You're going to stick your needle in the top there, draw it up, and you're good to go. Now, if you need to mix insulins, you're going to have your NPH, which may need to be rolled to be a suspension. So you're going to roll this between your 2 hands, and you're going to inject air into this that equals your dose. And then you're going to take it out and put it in the regular insulin after you wipe it down too. And then you're going to draw up how much you need of regular. You're going to go back to your suspension. You're going to wipe off the top again. And then you're going to draw up the amount you need of this. You can also inject into your legs. And what you could do is you're going to take your hand and take your thumb and feel where that bony process is right here. where your bone kind of ends near your pelvis. You put your thumb there. And you're going to put your hand down on the side. And you're going to inject right there between your thumb and your index. Inject right there. Do you feel like you got it?
Kind of, but I don't feel confident I could do it myself yet.
Okay, we'll run through it one more time while I'm giving you the insulin. And then the next round of insulin you can do yourself.
When performing an AccuCheck, you want to make sure all the supplies are ready to go. You'll need a pen with a needle, the AccuCheck itself, and the strips to put in the AccuCheck. You're going to remove the cap of the pen, insert the needle, and take the cap of the needle off. Put the cap of the pen back on. You're going to rub the skin for 30 seconds with an alcohol pad, and then you're going to let it sit and dry. While it's drying, remove a strip and put it in the machine. When you insert the strip, the machine will turn on. It'll notify you and say apply drop to let you know it's ready. Use the pen to prick the finger with a needle. Wipe the first drop of blood away. Then squeeze the finger again to draw up a second drop of blood. This drop we will use for the AccuCheck. Place the end of the strip on the droplet of blood. Give the patient a clean cotton pad or cotton ball to hold against their finger. Check the blood glucose level. Normal levels are between 60 to 100. As we can see, blood glucose is 92, which is a normal range. But for the sake of this demonstration, we're going to pretend it's high. Remove the strip, throw away any contaminated objects. I'll be demonstrating on how to administer insulin. I'll be going to the Pyxis. I'll be removing regular insulin and NPH insulin. I'm going to check the date to make sure it's not expired. Check the insulin for the appearance to be clear, colorless, and no clumps. Insulin lasts 28 days after the cap has been removed. I'll grab some alcohol pads and an insulin needle. I'm going to check each syringe to make sure it's 50 to 100. We'll only be administering 15 units, so I chose the 50 unit syringe. Here I'll be checking. I grabbed the right insulin again. Now I'm going to take NPH and roll it in my hands to make sure I get the particles up into suspension. It should be clear and cloudy. I'm going to take some alcohol pads and wipe the tops of the insulin vials. I'll be wiping for 15 seconds. For the sake of this video, I'll speed it up. I'll grab my syringe and prepare to draw up insulin. I'm going to draw back 10 units of air and inject that into my NPH insulin while stabilizing the needle in the vial to avoid contamination. Then I'll draw back 5 units of air to inject into my regular insulin. I will now draw back 5 units of insulin of regular insulin according to the order. I'm going to wipe off the top of the NPH insulin once more to ensure there will be no contamination of the insulin. I will now draw back 10 more units of NPH insulin for a total of 15 units of insulin. If I draw back too much, I have to start over because I can't inject regular insulin inside of the NPH insulin. That would cause contamination. Now that we have the appropriate dose, we're going to show another nurse to make sure that we have the exact dose we need, and they will co-sign it off. Scoop the needle cap back onto the needle. I will date, time, and put the patient's name and birthday, the medication, and the doses of the medication on the needle using a piece of tape or some form of labeling system. Once I'm ready to administer it onto the patient, we're going to get another alcohol pad and wipe the area of the skin for 30 seconds. For the sake of the demonstration, I will speed this up. I'll make sure I have the right patient, the right medication, the right dose, the right time, the right route, and I'll document correctly. Keep in mind, this is the insulin you'll be administering before the first meal of the day. Pinch the skin, insert the needle at 90 degrees, push, pull out, and release. Scoop up the needle cap and throw the needle away in the sharps container.